Welcome to the Mind Gut Conversation, your go-to podcast for exploring cutting-edge ideas in optimal health and the fascinating science of mind-gut microbiome interactions. I'm your host, Emma Maya. Here we bring together thought leaders, groundbreaking researchers, and innovative practitioners to share insights that can transform the way you understand your body, mind, and overall well-being. Whether you're a health enthusiast, a curious learner, or a professional in the field, this podcast is your gateway to unlocking the secrets of the mind-gut connection. So settle in, open your mind, and join us as we journey into the science and stories shaping the future of health. Today, I have the great pleasure to speak to Nora LaTorre, who is the CEO and co-founder of the award-winning nonprofit Eat Real. In this role, she is leading the global movement to solve the childhood health crisis by transforming our food systems, raising awareness, and innovating policy. In this podcast, we talk about why is Eat Real focused on children's nutrition and what has the success been in this area so far. Are there any outcome measures demonstrating fast-changing children's eating behavior positively affects health outcome in adolescents and adults? And how has Eat Real developed a fast, scalable, and enduring upstream solution to America's children's health crisis? Nora is an award-winning CEO, board member, mom, keynote speaker, investor, strategic advisor, and health advocate. She's a respected longevity thought leader and has been on stages presenting on human health optimization around the world. Her visionary approach has been highlighted by top podcasts by BBC, CNN, Fast Company, TED, and many others. Welcome to the show, Nora. Nice to see you on this podcast, Nora. Thanks for accepting it. It's always a pleasure to talk to you, and particularly at these times, I think it's what you're doing is particularly relevant. And let me just start this with a general introduction. As you know, there's this growing awareness of the crucial role that the unhealthy standard American diet, or SAD, has played in the chronic non-contagious disease epidemic, and the slogan MAHA by the new administration, with all its shortcomings and critiques, shows that the federal government has accepted the need for a major change in public nutrition, particularly for children. As the CEO of the nonprofit organization Eat Real, you have been working in this space for years and very successfully. Can you briefly explain the origin story and the goal of your organization?
Yeah, thank you so much for having me. You know that your book is on my shelf and that I was an early fan of yours and read everything that you publish, and I'm just so thankful for your guidance to the public, and then also to Eat Real, our children's health nonprofit. So Eat Real is a leading children's health nonprofit where we put real food on the table at home, at school, and in national policy. And it was originally founded by a couple of the top doctors in the world. Dr. Jordan Schlane of Private Medical teamed up with Dr. Robert Lustig, neuroendocrinologist, pediatrician out of UCSF, and a published author as well. And they really, in 2012 said, our kids are getting sick and it's the food. And people at that time weren't talking about the food. Real food is medicine was not trending. Make America Healthy Again was not on the radar. Like kind of the how sick our kids are and how sick they've been becoming wasn't on people's radar. And so they really felt like it was critical to help kids have access to real food so that we can stop disease before it starts. They felt like if we're going to do prevention and shift our public health crisis, then we need to start with the kids. And so I joined in 2019 as a brand new mom with a lot of fire. We become like hyper vigilant, I think, as new moms. And I have a big background in sustainable food systems and global food systems and movement building. And I saw what the doctors were building. And as someone who had worked in the food industry but felt like I didn't know a lot about nutrition, and I was newly pregnant, I was like, I need to learn as much as possible. And if I don't know and I've been working in the food industry, how's anyone supposed to know about nutrition? And so in 2019, we really went all in on schools and the power of school lunches. And we change real food in school, we raise awareness, and we do policy change. But the reason we went all in on schools is because they're the largest restaurant chain in America. They're bigger than Subway, Starbucks, and McDonald's combined. And so our theory of change is if you can change core calories for kids and make it real, nutrient dense, sustainable, local, delicious, then you change core calories. That's how you can reverse disease. That's how you can stop disease before it starts. And so our program in schools, we noticed back in 2019 that it was game changing and that it was having real measurable results because we would assess a school food program and then we'd help them make changes and we'd reassess. So we had a strong data-driven and science-based before and after. And we are just in love with the progress and that these local leaders in schools are now around the country. We went from one state in California to now we're on track to be in 20 states. We're
Wow.
working with 50,000 kids. Now we're on track to reach 1 million kids and 20 states nationwide. And so we were having these real results and these local leaders, these food service directors, these food heroes, and in towns and communities across the country are making change and cooking up change at school, and it's working and kids are loving it. So we've had a lot of fun doing that, making it fun to change your world. And then we also change policy and just general awareness. So real food in school really changes kids' lives.
I mean, how did you accomplish this that so many other people are just talking about, we have to change our diet, and including myself talk about that, you have all these headwinds from the farm industry and from the
Yeah.
food industry. And how did you accomplish that? Was there like an initial funding mechanism to get this started, or?
Yeah, so we're a nonprofit. We're funded by people that give $5 a month, $18 a month from philanthropists, from family foundations. We do have some government funding. The state of California gave us an incredible farm to school grant, multi-year, twice. Jennifer Siebel Newsom's been a big champion. We have USDA farm to school funding nationally to bring our program to the South. And then we have some amazing new corporate partners from Vitamix to Patagonia to OXO, the amazing kitchen utensil company. And so we have incredible partners who have come forward to fund our work. So our program we're able to offer it free of cost to school districts. And so really it's about standing next to these local heroes, and that's how we've had success because there's Michael Jochner out of Morgan Hill Unified and Kat from Tahoe Truckee and Cindy from Georgia and we have so many incredible partners around the country now that have raised their hand and said, I want to be an Eat Really. They call themselves the Eat Reallys, these food service directors. And they say, I want to serve my kids. They call them their kids. I want to serve my kids the best possible food, and I want Eat Real's help. And then they also invite their friends to join our program. And we have parents like Lynn Choi out of Capistrano. She reached out to Kristen in Capistrano, the food service director there in Southern California. And within 12 hours, they joined our program. And so it was a mom that told the food service director about it. So sometimes it's a parent, sometimes it's a food service director, and community members reaching out to us online and saying, hey, can I connect my school with your program? And it's these local heroes that want to have the support and want the data, want the celebration that we bring, that want to work with us. And it just starts to snowball. And so that's why it's truly a movement. It builds, it builds, it builds. First, we had one school district, then we had 5 school districts, and then we had 15, and then 20. And so just like and word of mouth starts to grow, and we're starting to see incredible results. We're starting to see schools actually be able to increase the number of kids eating the meals, their participation, which then increases the revenue of the school food program. And then they're allowed to invest, reinvest, reinvest, reinvest. And so schools are having great momentum and success implementing our program. And so word gets out, and then people text their friends, and people reach out to us on Instagram or on LinkedIn or in our email or on our website, and it happens like person to person. That's why this is truly the real food movement, because it is taking one person at a time, one change maker, one determined parent or a student in Virginia independently reviewed our standards and then wants to bring us to her state, and so. It's one person at a time. This movement is growing. It's really exciting. And that's why it is a grassroots movement. And then we take all that data and we partner with lawmakers to then transfer that into policy change.
So I sort of remember that Michelle Obama tried to do something like this years ago, and it ran into a lot of political opposition. So do you think that like her attempts failed because it came from the government, and yours is successful because it's a grassroots movement, not from top down, or?
I do think it's bottoms up, and our approach is like really showing what's possible, and that's why then we're able to change it into law because we're able to say like with we just helped pass the food dye with Assembly Member Gabriel bill, the first bill in the country that passed, and we were able to say we already removed food dye from 400 schools in California with these Eat Reallys. They already did it, and it's possible, it's feasible, the kids are happier, and so we were able to show in a grassroots way that it works, kind of proof of concept. And then that was then a policy proposal to just structurally make change for all 5 million kids in California. And then we testified in West Virginia, and then it became the FDA took it on. So I do think it's important to have grassroots, but I also think real leadership at the national and state level are crucial. I think she was pretty early, and so we're we're resting on the shoulders of giants who tried to make change and who were, challenging the status quo and challenging big food and challenging big ag, and they face a lot of opposition, and their work and the work of community leaders over decades are why now it's really starting to snowball. And now parents are, we've seen in the last year, are super determined and are concerned with their own health, right? Millennials are experiencing, like, we're shorter. My generation missed a critical growth spurt in the 80s. Like, we're seeing our friends get sicker. We're seeing cancer rates going up, colon cancer rates going up. I know you cover this a lot. And then, so we're worried about our friends and our family. And then we're starting to have kids and we're worried about our kids' health. And so I think now it's become personal for everyone. So there's this health shift that's happening that has been in motion in leaders like Michelle Obama and other really kind of, vibrant leaders in the farm to school and farm to table movements and chefs and leaders were stirring it up early on, or the farm to school movement, the farm to school network. Miguel Villarreal used to be on our board, and he's there at that nonprofit, and they've been doing this work for decades. So people have been working on this from a lot of different angles for a long time. This is really that's why it is a movement. There are tons of players that have made it all, kind of built the foundation, and now it's really accelerating.
So you've told this phenomenal success, in terms of numbers. What about outcomes? I mean, are there any ways that people measure outcomes? And so you are targeting children for a good reason. What about outcomes in adolescents or adult? I mean, or is this too early to have these kind of follow-ups?
We have some research hopefully coming out this fall that will have some very strong, promising. The research is done and it's being submitted, and we're really excited about what the research shows on our program and on Real Food's ability to transform kids' lives. And so I can't share about it yet.
Oh, no,
I'm
that's
like so excited. I might have to come back just like when we announce it because it is so exciting. We are developing a whole research pipeline, and I'd love to nerd out with you later on this because we have a bunch of new grants that we've written and grants that we want to write to really study this more. And so so the answer is like, stay tuned. There's a ton of independent research that we're trying to work on, everything from behavior change to the impact of real food on kids' mental health, behavior, their metabolic health, obesity, behavior change and social change, like family influence. So we are working on that. So really excited for that and hope that we can get some more funders because we have incredible research partners from top institutions around the country and super local institutions too that are ready and willing to do incredible research with us. So I'm really excited about our new research pipeline that we're working on. That said, three data points that we already have. One, we have data, and hopefully we'll be publishing soon on the business case for real food in schools and how it's a better business model for schools. And so we have data already, and we hope to have it independently verified that shows that when schools do our program, they're able to increase their revenue and their number of kids that are participating and then reinvest into chefs, central kitchens, more local food, grass-fed proteins, kimchi, like all the fermented foods, like so we're hopeful that that's going to be coming out. So participation numbers, which is really important to show that sometimes some changes don't have to cost more. You can make simple swaps and get out toxic ingredients. It doesn't have to cost schools more. That's a myth. And then some changes do cost more, like a higher quality protein or Mary's organic chicken, but that it's feasible and that it actually can help drive revenue and kids like it more and parents trust it more. So it's better for a school food business. So that's really exciting. And then participation numbers, seeing those go up, which really matter. And I know parents that like pick which community they want to move to based on the school food program. Or we've heard that. Like I was on Whidbey Island and they have I dream of that school food on this little island off of Seattle. It's a big island. It's one of the biggest islands in the country, but it's a little town. And they had heard that some parents chose to go to that school and like enroll, and a lot of schools are facing enrollment challenges, but enroll in the school because of the school food program, which was like the heartbeat and the epicenter of the school food program. So participation numbers we're seeing go up. And then anecdotally, we're hearing from teachers, from parents, from students. I have school lunch all the time. My team was just having school lunch last week, and the kids are like, "This is amazing." They actually, they're like, "This is the bomb." Like you eat with them, and you see how much joy they have. You can feel the energy in the cafeteria. They're like eating the Gambian stew with grass-fed beef and not the pizza. And the pizza is also like clean label and doesn't have dough conditioners and a bunch of, cheese like cheese. It's real cheese, focaccia, sourdough pizza that's like amazing itself. And there's just a buzz. And so you can feel it when you're in the lunchroom. And then you talk to kids and they're so into it. Like kids are foodies, and if it's delicious and it's good, it starts to create a real buzz. Like we've had one student, she's amazing. She felt like she was nourished from school meals and that it was really a safety net for her and that she like could rely on school meals, and she felt like it was part of the reason that she was able to focus. And then she got a scholarship to Stanford, and she felt like school meals really helped her achieve
Uh,
her academic dreams. So we're hearing stories like that. We're hearing football players that try a salad. They're like, "No, I don't want it." And then they come back. They're like, "I'm a salad guy. Turns out I'm a salad guy. Rocked my game." Or teachers that say, I went and met with a teacher, a sixth grade math teacher, and she said, since we have real food breakfasts and we have better real food lunches, my kids are able to focus better in math. And I haven't heard one, "I'm hungry." So anecdotally, we're getting incredible feedback. Or parents that are like, it's one less thing. There was just a study that came out about mothers and how much stress and depression they're facing right now and mental load. And we had a mom that just said, like, "I'm just so relieved that I can trust school meals. It's one less thing I have to worry about. It's one less thing economically my family has to go to the grocery store and like plan for all week. I'm like less stressed out at my husband. I'm more present with my kids." Like she just felt like such support from trustworthy, delicious school meals, a hot meal that her kid could enjoy and that one less thing she had to worry about because it was at school and it was like, a good teacher was like a good meal for her kids. And so we're just hearing great results, or parents on Facebook groups are saying, "Can I get that school recipe?" Or kids being like, "How do I get a chef at my house? Because the school chef is so awesome." Like we're just here. I have hundreds of stories, like, just anecdotally about what excitement and the real food
it's
creates.
really interesting. So you mentioned, the parents and the mothers several times who are obviously responsible for the kind of food that from infancy on that
Yeah.
children get. I mean, how have you been able to get the parents and the mothers involved? So many of them would not have done that kind of cooking or prepared this kind of food that you mentioned.
Yeah.
Um, how did you get them to change what they've been doing before? And so was there an educational process in the moms as well?
Yeah, so that's another reason why our kind of like hyper local and grassroots approach works because our food service directors live and like often live and work in the communities, and they have an army. They have food service staff that's out there feeding the kids and serving the kids and interacting with the community. So we really depend on that food service director to understand how do they want to educate, inspire, and communicate to their parents. So and then we have their backs. However, maybe it's like, newsletter content. Some of our schools do like a school night supper club and make it really cool and invite some parents and representatives, or we'll have a big Real certification party where we present to the school board and we invite PTA members and then have them disseminate information out. So we really understand how does information flow in their community. And then how do we celebrate it? So one of our districts who just signed on in rural Washington state, they said that their local movie theater is a big part of the community, so they want to run ads at the local community center when they get in that movie theater when they get certified. So we're game, like sure, let's do it. So it's kind of like it is very grassroots of understanding how do we put it in the newsletter? How do we menu it? How do you put little icons on the school food menu to show that this is planet sustaining, or or hyper local, or this is from the Johnson family farms down the street, that their kids are all in the school and on the sports teams. And so how do we really work with that food leader and help them think about, okay, how do you tell this message? We'll help you, but like, how do you get the word out as you make the changes? And then engaging folks like the PTA and the school board and whatnot, and then flowing it out that way. And then we have our own kind of social media and being on podcasts like this, like word does just start to grow. And so people being out on podcasts talking about us. We had Dr. Robert Lustig was on Huberman, and he mentioned us, and somebody from Connecticut reached out, and then Connecticut's on our program. Like it does, like these types of conversations, people sharing this podcast, people sending it to their spouse saying, let's do this in our school. Like that's how word gets out.
What about certain barriers? So, for example, socioeconomic barriers or political views. Or do you have the same success rate in, let's say, very conservative states? And have you been able to also include these programs into lower socioeconomic neighborhoods and schools?
So the answer is yes and yes. So we want to show that real food for kids is red, white, and blue. It's an American cause. It's not red versus blue. That our kids' health is a red, white, and blue issue, and that every side of the aisle, independents, Dems, Republicans, need to all prioritize and care. And so we strategically were working in red, blue, purple areas, winter, rural, urban. We're showing that this can work everywhere and that it needs to. And we work with any politician that truly cares. And so we work with a huge range of leaders. And when we work on policy change, also we work with a huge variety of leaders. So the bill that we're supporting Jesse Gabriel on, AB 1264 in California, that just passed the assembly in California, it would pass 65-1. And it had bipartisan support. It had a lot of Dem and Republican sponsors on it. And so that was them saying, even though the food lobby is kicking up a lot of dust on it, that's them saying, we are going to protect our kids from the most harmful ultra-processed foods in schools. We're going to prioritize our kids' health, and we're going to protect them in school. And so they came together across the aisle. So we're seeing that leaders across the aisle are coming together to collaborate on this. I do think that food and health, real food for our kids and real health for our kids can be a unifying cause in our country. Like it gives me the most hope, not just because I'm in it every day, but because I see leaders coming together saying that they really, really care, and not just politicians coming together, but like community members working on it together from all different backgrounds. And then, over 67% of the kids that we serve today are historically underserved. So we're looking at what are the health hotspots around the country. And when you look at health in America, like the South particularly gets disproportionately impacted by preventable diet-related disease and ultra-processed food-related disease. And by then they have the limited access to real food, and then they have disproportionate disease burden from that limited access. And then they are more subject to things like COVID hospitalization and deaths and pandemics that then impact it. So when you overlay the map of the United States, maybe I should go over here. I'm like looking at you, I'm like, it's over here. But so we're working now throughout the South. And we're looking at super rural communities that don't have as much access. So we're really trying to prioritize communities that have disproportionate negative health outcomes for kids, soaring diabetes, obesity, etc., pediatric cancers, etc., health kind of hotspots around the country, and then food, like places where there's limited food access and nutrition insecurity.
I mean, you don't have to convince me because I've sort of been preaching this all along that of all the various factors that contribute to this current chronic disease epidemic, food is definitely one of the top ones. Maybe not the only ones. I mean, there's
Right.
also, physical exercise and chronic stress levels and income levels. But
Sleep, social connection. Yeah.
yeah. So it's a whole ecosystem of factors that contributes obviously to our
Yeah.
health. And unfortunately, in some of these underprivileged communities, many of these are lacking. I can say this traveling across the country, that you can almost tell when you get into a certain part of the country or you look at certain, sections of the population, obesity is clearly not homogeneous. It's like very focused on some of these groups. And so this will be the most interesting thing from your outcome studies. Can you actually affect this, that you don't have people with like the whole thing at the airport, people who do the lower level jobs are
Yeah.
the most obese, can you affect that population, which I think will be the most incredible thing.
Yeah, I can't wait to show you our research. And with 67% of the kids that we serve in historically underserved populations, like we are showing that this intervention does work. And then now the research, and we have the before and after. So one super diverse and historically underserved community, and the one community they have Morgan Hill Unified, where Michael Jochner is. It's in the South Bay. It's in that county, Santa Clara County. Only Gilroy has worse health outcomes, and the kids in their communities are on track to live 5 years less than kids up the street. So huge health disparities. And they removed 34 pounds of sugar per student per year.
Wow, that's amazing.
They wheeled in a wagon to the school board meeting, and it was taller than my little kid. Like it was so tall. My little guy. It was like I had to like lift the 34 pounds as they were showing it to the school board. They went from 5 local vendors to 11. They have grass-fed beef, kale crumble pizza on homemade focaccia. They have cauliflower tiki masala that the kids are trying. They have hydroponic lettuce farms that the kids, they look like it's like a techno, it looks like light show, like techno light show.
That's
And the kids are like, and they have a farmer that is a graduate from the school teaching the kids about the things coming from the farm and from the greenhouse that they have, like the prettiest cucumbers. And and those kids now have access to much healthier, delicious, local, sustainable food. And so we're seeing it changing lives in these populations, and it's like so exciting. And the pride that these kids have, like they have such joy and they're so proud of their school food. It's super exciting. So and we'll have more and more research, and hopefully we'll get some more research funding. Like I would love to study kids' gut health and then the impact on their mental health with you, for example. That
Yeah.
would be so cool. Like imagine the studies that we could do. So and I wanted to talk to you about it too, because our schools, like Michael and Morgan Hill, is doing a lot of pickling right now, which I know that that's something that you really like. And then on Whidbey Island, I had kimchi that was cabbage from the local school farm. And then in Natomas Unified, which is the third most diverse district in the country, they had asparagus kimchi that was
Wow.
so good. Like the fermented foods in these schools, and it's like culturally relevant items and cool items that are trending on Food Network, like it's so cool what these kids are getting to try.
So have you also like one consideration that with food always comes up, is it grown in a sustainable fashion? Because I mean, obviously agriculture, chemical or industrial agriculture
Yeah,
does a lot of damage to our ecosystems and also indirectly to the health. I mean, it's sort of
right.
this one health concept that, like you can't fix one part of it once
Yeah.
once you start look. So does that also these considerations about, sustainable regenerative agriculture, does that also go into your into your teaching and into practice?
Yeah, actually, Dr. Boyana Weatherly, who's on our medical advisory board, and she was an early advisor, she's like, you don't want the food to come with the side of pesticides. Like, let's not do that, you know? And now I always picture just like, does this food have just like a dollop of, does it come with like a jar of pesticides? You can't unsee that. And then thinking about your research and what then that can do to the microbiome. And is that feeding the good army in our kid's
Yeah.
stomach or the bad army? Like if it kills all the bugs, what's it doing to the gut bacteria in our guts, and then our kids' guts? So in their sensitive growing microbiome. And so we do try to encourage, we're working in a really complex food system. We're trying to make change in a myriad of ways. And we do try to help our schools. We think schools can become the biggest buyers of regenerative organic egg in the country, and they should be because it helps the local ecosystem, it helps the air quality locally, it helps the kids and the end consumer, the kids. And so we, with one partner, with Cream Co, which is an awesome regenerative organic protein company, that our schools and the schools in our program, the Eat Reallys in California, generated over $1 million to grass-fed organic beef ranchers in just a year. And so we're seeing this like schools changing their purchasing dollars, re-regionalizing the food system, and then prioritizing these organic regenerative farms and ranches. And they have like 100 types of native grasses growing, hawks flying overhead. The kids are running in the field. The farming families feel great with their kids getting exposure to everything on the crop. And so we're seeing an uptick in more organic, more local, more seasonal, so like more ripe and higher nutrient potency and more regenerative too. And that's, whether it's lettuce and especially helping them think through, especially berries and some of those like higher risk, or the EWG has the dirty dozen, like looking at especially for key crops that have maybe don't have a shell, et cetera. How do you focus on the most important ones to switch to organic and regenerative? And then helping them shift and find these suppliers and find these alternatives. So we're seeing beautiful organic peaches and like some of the best, like, yeah, organic raspberries. Oh my goodness, these strawberries, blueberries. I mean, that I've had some of the best fruit of my life, like fruit that growing up in Minnesota I never even saw. Like I don't think that now on our school salad bars that it's just like rainbow beautiful variety and organic and safe and from a farm where those farmers are also safe growing that product, and there's that, cleaner air as a result and cleaner waterways nearby, and it's happening. Like schools can, especially with more farm to school funding and more USDA funding and more state level funding, farm to school grants are critical. There were unfortunately some that were just cut, and those need to be reinstated and doubled down on if we want to make our kids really healthy. And so we need to be incentivizing and changing this is where the policy change comes in, changing some of the commodity structures. There's school food commodities, and prioritizing more local, or giving flexibility to schools to use those commodity dollars to buy more locally. I was like, if you ask me what I'm doing on a Sunday night, it's reading the US school food commodities list. And like organic is not something big on there. And so how do we get more organic items to be available to our schools and just make it easier for them to source locally and regeneratively?
I mean, just listening to you and your enthusiasm and your success, which is objectively demonstrated. Otherwise, I wouldn't believe it because it's almost too good to be true. But I mean, you have the numbers, and have you interacted or do you plan to interact with our current administration, specifically RFK and his plans, to make America healthy again? Is this something that's on your horizon, or?
We shared with any leader who cares, we will share. And with the last administration and this administration, we've shared that we believe that schools are the fastest, most effective way to create health for our kids through real food. And so we are dedicated to like showing the power of school food and really encouraging investment. One thing that we've been trying to say uh, pretty loudly is that we have to spend a few $1 billion a year on real food for kids in order to save trillions of dollars
Mhm.
of sick care, healthcare costs, since, so much of our 4 trillion plus on healthcare spending is preventable ultra processed food related disease. If we just spend money on real food for kids in the tunes of billions of dollars, then we can stop disease before it starts. And so at a policy level, that's critical, right? And so it's super important. And we already spend billions of dollars a year through the farm bill, through school food subsidies, et cetera, on subsidizing certain products, et cetera, and big multinationals versus the small, local, more regenerative, real food suppliers. And so we need to think about how do we just take those dollars and optimize them and spend them better? And then how do we double down and give on the programs that work? Because when schools have farm to school Kickstarter grants, they start to buy locally. They start to buy organic. And there are some, the government could give cash in lieu, for example. They could give, that's very technical, but let me explain it as they could let schools have commodity dollars that are used locally. And so there are some simple things that the new administration and any administration can do to create more investment, and it will take more investment. And so that's kind of, we don't spend enough and invest enough upstream on reimbursement rates, on grants, on proven models that work. And so, and unfortunately, some of the key programs, the farm to school funding was just cut in the last couple of months. And so that we need to actually double down and invest and quickly.
Yeah, it's an interesting situation right now that, there's this increased awareness of this need for, make America healthy again, which I think is great. But it also does increasing headwinds in terms of, federal funding, NIH funding. There's also, very strong lobbies of the big agricultural companies, and criticism has already come up from senators from states, that are the big players in these monocultures of corn and use of pesticides. So the
Big
interesting
food,
thing to
big
me,
pharma, big ag.
yeah,
Like,
so this, yeah, also, I mean, in some ways, even though I am part of the medical system. Obviously, the medical system, the medical industrial complex,
mhm.
has profited tremendously from these chronic diseases. I mean,
Yeah.
that's essentially. So when you look at it, I mean, there's all these factors that you ultimately will be facing. So it's particularly, to me, encouraging to see how much success you have had as a relatively small entity
Yeah.
taking on these giant forces, that
David
have.
versus Goliath a little bit like this one. But we come together with other incredible organizations. Like we've just been working with the Environmental Working Group on this bill, or leaders like Assemblymember Gabriel. It's like finding your friends that really deeply are valued aligned and move fast and are bold and are determined to give our kids a fighting chance at health and long, healthy, happy lives. So I think we're finding our people.
So one sort of a final question I have is, I mean, how do you see it's always difficult to look into the future with all these unpredictable factors going on at the moment. But what do you think, based on your success so far, in 10 years from now, what do you think? Do you think this actually make a dent on the chronic disease epidemic? Or, which I often say sadly, really, that the only thing that's going to change it is these GLP-1 agonists, because no
Yeah.
people don't have to do anything. They just take that shot, and probably pretty soon it's going to be in the form of a pill. So the big question to me is, are these efforts that you're spearheading that are actually quite successful, are they likely to be able to compete with the pharma approach, which is going to generate billions of dollars for the pharmaceutical industry?
Yeah, I think Ozempic is being tested on 6-year-olds. And, I talked about that in a talk I gave at Next Med Health like years ago, and was kind of raising the flag on that. We have to be really cautious and need a lot more research on the effect of GLP-1s on kids. And like that is a lifetime commitment of ongoing medication.
Mhm.
And we don't know what that does to their development, what that does to their gut health, what that does to their brain development, what it does to their hormones. It is so untested. And so to be experimenting is I mean, is nerve-wracking on the unintended consequences that could have on one child's life and on population health. It's concerning for sure. And we know there are simple things that we can do to get our kids healthy, and there are easy investments that the government can make structural change to really create health for our kids so that we can, get them healthy so that they don't need the Ozempic, so that they don't need geriatric surgery at 13. So
Yeah.
I think it's really that's why we really, really think it's key to get kids real food. And as a mom too, like we actually at Eat Real don't work. We work in prenatal because we're helping like the next generation of parents, right, have healthier metabolisms. But my journey started prenatal, and like when and I hope that we can start empowering moms on how to really nourish themselves and nourish their growing children and reduce sugar in pregnancy, get more nutrients in pregnancy, don't let kids have added or free sugar 2 and under, like really ring the bell on some simple things that we can do for the littlest of kids, and then Eat Real coming in and helping at the school age level and then helping families make changes. It is going to be I'm not naive. I am very optimistic and we are very determined and we're seeing a ton of success. And I am not naive about how much work it will take to really shift these downward health trends. Like 3 out of 5 kids are on track to be obese by the time they're 35. America is facing a bigger health crisis than people are even talking about, even some of the reports that are coming out. And we're not studying it because there's not enough funding. And
Yeah,
so
it's amazing. Yeah.
so it's much worse than we even realize. And that's why I'm really thankful for like the MAHA report that just came out, because that it's opening people's eyes, and it's saying that every administration is going to have a stance on our children's health from here on out. It's the minimum. And every politician will need to be taking action because parents are worried. Like parents see it, teachers see it. Like America is rightfully concerned about our kids' health. And I think it kind of goes back to the idea of American progress. Like it's an American ideal to have progress, to give our kids a better life, to give them a longer life, to give them a healthier life, to give them a happier life. We want to give our kids a better life. And we're looking at so many of the measures, and especially our kids' health, and we're saying, we're giving them shorter lives, we're giving them less healthy lives, we're giving them less happiness. Our kids are more and more depressed and more suicidal, and they're like not feeling good. Something's wrong, and our kids are not feeling good. And they're not on track to have these beautiful lives that they deserve, that we want to give them. And so I do think that there's an awakening that's happening in every part of the country where parents are concerned and they're determined. And so I have a lot of faith in the determination of the American people, and that once we confront this, and we're starting to right now, that in the next 10 years we can make a shift, and then we can get back to the basics of real food, connection, sleep, like stress reduction for our kids, and really think about how do we nourish our kids and change the health of our nation and restore progress.
What can people do? So you're a nonprofit organization,
Yeah.
so you accept donations
Yes,
and
yes, it would be amazing. Eatreal.org/donate. We actually have a mission to 1 million right now. And so we're trying to reach 1 million kids, and every donation really matters. And so, whether or not we can launch in 15 to 20 states in the next school year and reach 1 million kids nationwide is on whether or not we receive donations. So it would be a huge help. And, $5 to $10 can help a kid have access to real food in school for an entire year plus. So every dollar really goes far with our small nonprofit, and so that would be huge. They can follow us on social media. It's Eat Real Certified. We're on LinkedIn. We're on Instagram. I'm Nourished with Nora, and I talk a lot about our different programs and our results and whatnot. And so, we'd love for people to give and for them to join the conversation. They can sign up for our newsletter, and we have some fun newsletter. And our social media team is so fun. Our marketing team is really fun. So they have like all sorts of different engaging things online, and I'm like, and that they talk a lot about school food and share recipes and whatnot. So it's a fun newsletter to subscribe to, social media accounts to follow.
Yeah, so thanks again, Nora. Fascinating conversation, and I'm deeply impressed by your enthusiasm and your motivation and your success, obviously. So, looking forward to follow your success into the future. It's definitely something, one of the most optimistic talks that I've had with somebody on this podcast.
Thank you. Well, thank you for, I know you've been a huge supporter of Eat Real, and just I learned so much from you. And I hope we get to do some research together. So let's figure out some funding also, so that we can some massive funding so that we can do some deep dive research on this. That would be and really powerful.
Sounds great. Sounds great.
Thank you.
Thank you.